Go ahead and start live on
Hello, everybody.
Instagram as well.
Oh,
Setting up, setting up for YouTube live. Hi,
hello,
hello.
everybody.
It looks like we're live on
Uh,
YouTube.
uh, okay. I'm looking up here to see when we go live on Instagram.
Hi guys.
Hello.
Hey, welcome in. All right. Um, so I am live on YouTube now, and I'm live on Instagram. Hello, prettiest Sierra. How are you? Happy Friday. All right, we're gonna.
I don't see you live on my Instagram.
Oh, you have to refresh the live.
Oh, you're right.
Hi.
I always forget to do that. Now you're live
Oh,
on.
oh, Esperanza. Thank you. Don't. That's a great start to my day. Thank you. Hello, it's a pretty P.
I sent you a
How are you
request.
guys? All right, we're gonna wait for Dr. Q. Oh, there's the request. Do you guys have some juicy questions ready for Dr. Q? Let's stump him today. Let's stump him.
Be kind.
Be kind, he says. Be kind. Hi, sickle cell survivor. All right.
Hello,
Um,
everybody.
Happy New Year. We haven't seen you
Yes.
this
Oh, that's
year.
right.
Happy New Year. I
We were
mean,
supposed to.
it's mid-January. I still say Happy
Yeah.
New Year.
Oh, bummer. Somebody's in the ER.
Oh
For
no,
11
for 11
hours? Get out of
hours.
here.
What? I mean, I think we can. What have you? Who's there with you? I have so many questions. Who's there with you? Have you contacted your hematologist or your sickle cell expert to help facilitate them getting you back?
Yeah, show them
Where,
your iPad with us on there and I'll run the riot act by them.
yeah, that would be amazing, actually. Oh my gosh. All right. Yes, just,
Oh,
oh,
man.
I'm so, so sorry. I'm
Yeah,
so sorry.
that's one of the problems with the emergency room is it depends on where you are but if it's like a inner city or it's near, it's not like it's not like Children's ER was not really it was in Oakland, but it wasn't right in the city. But if you're in a really busy ED and they're getting car accidents, et cetera, then but I doubt that it's been 11
Location
hours.
matters. Is that what you're trying to
I don't
say?
think they've been busy like that busy for 11 hours straight for sure.
Oh, yeah. I'm so sorry. Hang in there. Let us know if you have
Uh,
any questions while you're there, and we can answer hopefully in real time.
oh, North Carolina.
North
So her
Carolina.
daughter was
Okay.
there for 3 hours and ended up catching the flu. Oh my God. Okay.
Oh, I'm glad your doctor's handling it. That's,
Yeah.
when I rolled up in the ER, you know who I called? Yeah, and I was like, handle
Well,
it. No, I'm playing.
we were fortunate in that Children's in Oakland had a sickle cell program, so they didn't always, you didn't know who was going to be in the ED, but you could call them up and they did. If I call an ED outside of Children's, like in the Valley, we're in California, so in the Valley or somewhere else, I got a lot of pushback when I said, this person has sickle cell, you've got to do this and that, and they're kind of like, "Hey, I'm a doctor, I know how to do this," and I'm like, maybe
But
you
you're not a
don't."
sickle cell specialist, though.
Yeah,
So,
right. I've seen three sickle cell patients. I know everything there is to know about sickle cell.
oh. Well, yes, please feel free to, ask any questions while you're there. And
Yeah,
I think I see a question already. Have you ever been to a SCDAA convention? I usually go every year. Have you?
yeah. Yeah, I think I've gone to one only though.
Oh, I'm so glad we're lifting your spirits. Please use us as a resource while we're here. Um, All right. Do we have any questions you all want to start us out with? Um, and I can go to a question that was previously sent in. I can I can start us off with a question that I don't know the answer to.
Uh-oh, that's bad.
Well, it's really
Okay.
technical. You know how people be asking sophisticated questions that, go above me. Um, so it says, does it make a difference if the fetal percentage is 30 versus 40 versus 50?
It will raise they'll raise the total hemoglobin perhaps, but in terms of is it better to have 30 to 50, I don't think it makes that much difference. Although having a higher hemoglobin is good. Um, so, it's better to have when you get up to fetal hemoglobins of that high a level, what you're kind of looking at is how is the hemoglobin high enough to make a difference? Because after about 20% or for sure 30, I don't think, I'm just guessing, but I don't think it makes that much difference in terms of the effect of the fetal hemoglobin. People who have hereditary persistence of fetal hemoglobin with sickle cell and have very few, if any, symptoms, their fetal hemoglobin is around 30%, 35%. So once you get up to 30 somewhere between 30 and 40, you don't have symptoms. And if it's over that, then um, it just makes your hemoglobin higher, which is not bad unless it gets too high. But
So what is the goal to have your fetal hemoglobin? And fetal hemoglobin is anti-sickling,
right.
so it's what a lot of doctors want to see is a higher fetal hemoglobin. So what is the range? Where are you supposed to be at?
Well, people say that once that the goal is 20% fetal hemoglobin. That's kind of the goal. So when you're giving hydroxyurea and you're looking at the fetal hemoglobin, and because with hydroxyurea, you're balancing side effects versus good effects. So you keep raising the dose of hydroxyurea, and some people use the white count. People with sickle cell disease have a higher white count than what people without sickle cell disease have. So what they want to do is they want to see that white count come down closer to normal, which is like maybe from 12 or something down to maybe 6 or 7. And so they're looking at that. So they're monitoring that for the dose, but then they also are looking at the fetal hemoglobin. And once it gets to be 20%, something like that, then or higher, then they know that the hydroxyurea is working. The same thing for anything else that raises fetal hemoglobin, like the gene therapy that raises fetal hemoglobin, it's around 30% or so, I think. But that's they get the difference between that and say hydroxyurea is once you've had the gene therapy, that is a sustained fetal hemoglobin that doesn't change. If you're on hydroxyurea, depending on how off if you miss doses or if you're a kid and you're getting bigger and you need your dose increased as you get bigger, then that's a different story. So then you have to kind of juggle it, and your fetal hemoglobin may go down as if you're 8 and you put on pounds when you're 10, you'd have to increase the dose. But with gene therapy, it's set in stone. You're going to have fetal hemoglobin for, as long as we don't know how long gene therapy, how durable that is. My assumption is it's forever because that's the way a bone marrow transplant works usually. So that fetal hemoglobin will stay up the whole time for the rest of your life. You'll have no symptoms. I can't hear you. I don't know. I still can't hear you. I don't know if other can, I
Can
don't
you
know
hear
if
me
other,
now?
yes, yes, yes.
Okay. So we have a doctor that says, I've seen sickle cell patients. I'm a transfusion medicine physician. Um, Thank you for tuning in.
Yeah.
Somebody, any comment on that? Because I know Dr.
I
Q's
I did a
super in.
fellowship, even though I'm a pediatrician, I'm not a hematologist. I did a fellowship in transfusion medicine, which is really helpful when you're taking care of people with sickle cell disease. I ran the apheresis unit and the day hospital. So, I felt like, gee, I should really know something about what I'm doing here. So I did a 2-year fellowship in transfusion medicine. And because people with sickle cell disease get some people especially get a lot of transfusions, and there's a propensity to have what's called alloimmunization, or you make antibodies against transfused blood. So once you make an antibody against some antigen on a donated unit, then you can't get that antigen can't be on your blood on the recipient's blood anymore, or you're going to have a transfusion reaction. And it can be kind of like a little bit hard to find blood, or not that hard, or it can be literally impossible. So we had a young kid who um, had an antibody to a very, very common antigen. And so he couldn't get blood just from the vast majority of donors. And through the Rare Blood Center in New York, they had two donors in the country. One was in Florida, and I think one was in North Carolina. I can't remember. But they were the only two people that they could find that would donate blood. So if he got sick and needed blood, we had to call the New York Blood Center. They would call the blood bank wherever in Florida, and then that person would donate, and that blood would be put on an airplane and sent up to Oakland. So we
Did
had
he get to meet the guy who or the
no
person, the
that
guy or girl?
unless the person who's donate, private, it's like.
I would make that person my best friend. Long
So,
story short,
yeah.
like,
Well, you're closely related because you've got the same. I mean, I think if the person who the donor, if the donor said, I'd like to meet the person I'm donating for, and then they got in touch with the family, then that would happen. You couldn't do it the other way. The blood bank would never tell the recipient who the donor was unless they initiated that. So. But a lot of times, people who are donors for bone marrow transplants and stuff, they want to meet the person that they donated for, an unrelated donor. And that's happened. Everybody has to be in agreement.
yeah. All right, I see a couple more comments. Hi, I'm from Pakistan, and in Pakistan, it's rare to have sickle cell. I have it sounds like this person has sickle cell and their brother. Right now, I'm facing knee pains and muscle weakness a lot. I hate the knee pain. The knee pain is the worst because you have to use your legs to walk around, and when you use your legs, you have to bend them. And it's like when you bend them, I don't know if it's for everybody, but for me, when I'm bending my knee, that's where like the pain like becomes bigger and a lot harder. And it's such an inconvenience. So I feel for you. And sometimes it feels like my kneecaps are even a little like wiggly. I don't know. I know there's a lot of inflammation there. But knee pain is the worst. So I'm so sorry
Yeah.
to hear that.
Yeah, I'm like a little on the older side, and I have like sort of really mild back pain all the time. It's not a big deal. But for about 3 days, I had really bad back pain where I had to like pull myself up, and the whole time I was just thinking, wow, I would not be a good sickle cell patient because I was really cranky.
Well, it's a good admission. We love to hear it. We love to hear it because it's tough. It really is.
The thing is too, is it just doesn't always seem to have a reason for happening. It just comes on,
Yeah.
you're doing something and yeah, I can't go. I mean, how many people have missed birthdays, Christmas, that kind of stuff because they were sick?
Okay. Looking through your questions, my son, okay, this person's son has a high level of fetal hemoglobin. That's what we all want. What can I do to keep him from having to visit the hospital? Okay, so I think this is the same person. Their son has very, very high hemoglobin. I want to say it's in the 30 range. He hardly has symptoms. Would that be considered persistent fetal hemoglobin
Well, if they weren't
at
taking a,
30?
yeah, if
Yeah,
they
and
weren't,
they're not taking hydroxyurea or anything.
right. So that's
That would be
hereditary
persistent fetal
persistent of
hemoglobin.
fetal hemoglobin, yeah.
Yeah. Is
And
there anything else she can do additionally, or is it kind of like,
um, technically, this is where you need to talk to your hematologist because you have to be sure that that hemoglobin is always 30%. Usually it is, but you have to make sure that there's not something else that's you can still have a little bit of pain, I guess, but you should be people who have had bone marrow transplants or gene therapy who have a fetal hemoglobin of 30% usually do not have symptoms. But again, with the gene therapy, that's your blood that you're getting back. But with a transplant, you're getting normal blood back, usually, or sickle cell trait at the most. So that's the difference between gene therapy and unless you have unless they, there's a gene therapy that increases fetal hemoglobin. There's a gene therapy that actually um, inserts a different kind but normal hemoglobin into your progenitor cells. That is a that is an engineered normal. Well, it's not hemoglobin A, but it's an engineered hemoglobin so that it prevents sickling. So that type of thing is different. So then you have not your own the blood that you're getting from that therapy is not your blood. It's your blood, but with a different kind of hemoglobin.
all right, what are the challenges of doing the bone marrow transplant in adulthood, late 20s, like 28?
Well, it depends on how many complications of sickle cell that you've had. By at that age, people have had definitely been hospitalized a lot, etc. But if you don't have lung disease and you don't have any organ damage, then this is something you got to talk to a transplanter with because they have your history. But then if you were relatively healthy, then you would be a candidate for what like the conditioning that they call it making room for the transplant, where they give you chemotherapy to kill your progenitor cells in your bone marrow. That could be a little bit stronger because you might be able to tolerate that better, which improves the chance of engraftment from the donor um, uh, progenitor cells. So that makes a difference in terms of how well the engraftment is. And there's a lot of other things. But if you have organ damage, which, people who are older than 20 get bone marrow transplants, then they have to give a kind of a modified, less intense kind of um, conditioning, which doesn't really seem to make an incredible amount of difference. People still do okay, but there is more kind of, engraftment problems potentially with that when you get to be older. And you don't tolerate, you get sicker, you don't tolerate the conditioning as well as, say, some like a little kid or a 20-year-old or so. If you're healthy, you're gonna you haven't don't have lung disease, heart disease, or anything. And if you're not iron overloaded, if you've been on transfusions a lot, iron the iron your body can't get rid of iron. So with transfusions, if you're not doing what's called a chelator to get rid of the iron, then that also affects the outcome on a bone marrow transplant, depending on what your iron level is.
Okay. Um, so I have this question here. This person's taking hydroxyurea, 100, I'm sorry, 1,000 milligrams a day. Hemoglobin is at about 7.8 to 8 most of the time, and they're having knee pain and muscle weakness. And so I also saw another comment that says somebody's taking 1,500 milligrams of hydroxyurea and they don't feel like it's working and they're always tired. So can you, I guess, address some of these comments around what hydroxyurea is supposed to do and what it's used for and what it's not used for? And before you answer, I'll just share quickly. I don't necessarily take hydroxyurea for um raising my hemoglobin or to be in less pain or to tackle fatigue, although it may help people in that way. But the reason I take hydroxyurea is for organ preservation and to kind of slow the damage down that sickle cell, wreaks on our whole body. And so when I started taking hydroxyurea, I went in not for it to lower pain, not for it to make me energetic, not even necessarily for it to raise my hemoglobin, but rather just to protect my organs. And so I think a lot of times, I'm not sure if providers are level setting expectations of hydroxyurea. So Dr. Q, could you speak to that a little bit?
Yeah, so the dosing of hydroxyurea has to be at a level, and it's different for everybody. For your weight, how old you are, people get older, their bone marrow isn't quite as tolerant of hydroxyurea. Hydroxyurea um, actually, and this is just this is what I've read, and it actually interferes part of the reason why your fetal hemoglobin goes up. It may do what some of the gene therapy does. There's a when you're born, you have high levels of fetal hemoglobin. Over time, there's a gene that turns off the fetal hemoglobin, and then your regular hemoglobin goes up. And in the case of sickle cell, that's sickle cell hemoglobin. For me, it just means my hemoglobin A goes up and I'm good to go. But what sickle cell may do is interfere with the function of the gene that turns off fetal hemoglobin. And that may be the reason, I've only read one paper, so that doesn't count too much, but it may be the reason that the fetal hemoglobin goes up. People used to call it like stress erythropoiesis, and nobody really understood why would the fetal hemoglobin go up. Although it's seen in fetal hemoglobin does go up in people who are on hydroxyurea who don't have sickle cell. Anyway, so what you want to do is you want to have a dose of hydroxyurea that decreases your white count some percent, and it's different for everybody. That's why you have to have someone who's prescribing this who can do the blood tests, interpret what they mean, and change your dose depending on your overall, like if your reticulocyte count, which is your baby red cells that are just coming out of the bone marrow, if those go down, that means if those are really low, that means you're on too high a dose, and your bone marrow is kind of not producing as many red cells as it should produce. And someone who's on hydroxyurea who has a hemoglobin of 7, they need to, they should be, there should be some discussion with their primary care provider as, is that okay? I don't know what their fetal hemoglobin is, but if your total hemoglobin is 7, I don't know. But anyway, so it's a balancing act, and things can happen. So when I was taking care of kids with sickle cell, sometimes they would get like they would get not really sick, but they'd have a cold or something, or they just wouldn't feel well. And all of a sudden, some of their counts would drop. And then I would stop their hemoglobin or their hydroxyurea for maybe a week or something, and then restart it and check their labs to make sure everything was okay. You do need to have lab tests to make sure your white count isn't too low because it can get so low that you're more susceptible to infections, that your hemoglobin isn't too low because that's going to make you feel really tired. And it also may mean that your fetal hemoglobin isn't that high because part of the reason why people with sickle cell disease on hydroxyurea have a high hemoglobin, besides the fact that hydroxyurea or fetal hemoglobin interferes with sickling, is that the fetal hemoglobin itself increases the total hemoglobin. So, those are the parameters, and it's different for everybody. It could be different for the same person depending on whether they recently had the flu or some other really, maybe just a cold or something, which will affect the way your body reacts, the way your immune system reacts. But people say that once you are on a stable dose, you just need to be checked every couple of months. And I would the the I was taking care of kids whose body weight changes all the time, but I would check everybody about like every 2 months. Although other people say you can go to 3 months or longer. And again, it depends on how long you're on it. If you're on it and I'm taking your blood count every 2 months and it's always the same, it looks okay, looks okay, looks okay, then I might spread that out. But you have to check the counts and the dose and make sure that you're not on too high a dose, which might give you a hemoglobin of 7, or uh, too low a dose. Either one could cause this. Too high a dose could cause your hemoglobin to go down, or too low a dose where it's not doing anything. If that's your sort of baseline hemoglobin for sickle cell, then it means you might have to fiddle with the dose to increase it a little bit, especially if your fetal hemoglobin isn't doing anything. So
I
it's
have a follow.
complicated. It's
I have
complicated.
I have a follow-up question. This person said, I thought hydroxyurea was made for cancer, and initially it was Dr. Q. Was it leukemia or
Yeah.
AML? Is that
No,
what it
it
was?
was for chronic, kind of a chronic leukemia. But
It's for okay,
and they
chronic
still use it
leukemia.
for that. So it's still used for people who have cancer. And the reason why it's used in people with sickle cell disease is that, way back in the 80s or whatever, people realized that some people who are on hydroxyurea, when they were doing their checking their blood counts, etc., they realized their fetal hemoglobin was higher on hydroxyurea. They also knew that babies, this was a long time ago, a woman who was a pediatrician said, fetal hemoglobin this was a long time ago. Fetal hemoglobin is protective against sickle cell disease because babies never have any problems until their fetal hemoglobin goes down. So people have known for a while that increasing your fetal hemoglobin decreases problems with sickle cell disease. So
Yeah.
um, and I kind of forgot the question, but so
Oh,
that
if it was made for cancer.
yeah, but so the dose that's been studied pretty well. So other people get hydroxyurea for other things, and hydroxyurea has been shown in sickle cell disease in many studies, that it does not increase the level of cancer in people with sickle cell. You have to also realize that for some reason, nobody knows why, but people with sickle cell disease compared to the population as a whole have a higher incidence of cancer. So it's not like huge, but they're compared to baseline for sickle cell disease, hydroxyurea does not increase your risk for cancer. And part of it, I think, is because it's being monitored. So the dose is changing and people are watching to make sure that everything looks okay while you're taking hydroxyurea. But in any event, it has been shown at the doses and the way we monitor um, hydroxyurea in sickle cell, it does not increase cancer.
And what I'll add to that is there are a lot of, I guess, drugs or therapeutics that are used in multiple patient populations because, actually people will bring this up. They say, oh, hydroxyurea wasn't made for sickle cell, which is why I'm not taking it. But that's actually within drug development. They look at a patient population, they see it working, and so they look at maybe another patient population to see if there's any effect or, um, what I want to say is it's common within drug development to have one therapy and to see if it works for even more people. And so a lot of people, it's a turn off that sickle cell. I'm sorry, that hydroxy wasn't initially created for sickle cell, but it's quite common within drug development. So don't let that particular reason deter you from trying hydroxyurea. I'm not sure how many patient populations take hydroxyurea. Would you have an idea,
Well,
Dr. Q?
some people, depending on what kind of thalassemia they have, they might take hydroxyurea. Of course, people who have cancer take hydroxyurea, people with sickle cell, and there may be some other uses, but I'm not absolutely sure that hydroxyurea is used outside of hemoglobinopathies and cancer. I'm not sure that hydroxyurea is used, say, for immune disease or something like that. I don't think so, but I don't know for absolutely for sure.
I have a few more follow-up questions about you guys want to really talk about hydroxyurea. So I have been on hydria or hydroxyurea
Yeah.
um for 10 years now, and I am now on 1500 milligrams, and it really helps. My problem is that I'm almost 32 and want children. My
Uh,
sperm count is very low. I want to start making children next year.
well, the recommendation for men and women is that you not take hydroxyurea if you're planning on a pregnancy or if you're pregnant. So that's kind of opens the door to if you really if you have a partner and you want to have children, you shouldn't be taking hydroxyurea. Hydroxyurea probably does not, uh, is not a teratogen at the doses in human beings. It is in animals if you give
What
them
is a
really
teratogen? What's
a
a
teratogen
teratogen?
is like causing birth defects. So
Okay.
it in animals, if you give them a lot of hydroxyurea just to see what'll happen, what is like the toxic dose of hydroxyurea, you do have birth defects in those animals. But th those studies are done to kind of figure out, well, what is a really bad high dose and what's kind of an okay dose where you don't have any effects. So at the doses that are given to people with sickle cell disease, it does not appear that it is a that it causes birth defects. And some women have been take hydroxyurea during pregnancy, and they don't have problem. Their children don't have problems. Um, Not maybe not through the entire pregnancy, but for sure, people get pregnant while they're on hydroxyurea, and then when they realize they're pregnant, they stop the medication. Um, it's true that it decreased people with men with sickle cell disease have lower sperm counts than the general population. And it's also true that when you take hydroxyurea, they go down a little bit more, but you're not infertile. So even if you're on hydroxyurea and you can inadvertently or on purpose have, have your partner become pregnant and have a baby, and they don't, and it's having problems with the pregnancy in that situation is really low or maybe almost non-existent. Um,
Uh,
but if you stop the hydroxyurea, your sperm count goes right back up to where it was before. It's not permanent. It's affected by the hydroxyurea. And once you remove the hydroxyurea, everything goes back to the way it was before you were taking it. And so if you really wanted to have, this is, again, these are things that you really need to sit down with your hematologist or your provider with to decide, because they know your accounts and they know to decide, okay, if I stop hydroxyurea on this day, then and my partner gets pregnant, or is there or are you going to check check my blood counts to make sure I'm not kind of going backwards and my fetal hemoglobin is down, my hemoglobin itself is going down, I'm starting to have more pain and stuff like that. You have to balance all that. And you can't do that unless you are in a partnership with the person who's providing care and you make a deal that, okay, these are the things that I'm going to be looking out for if I stop hydroxyurea, and this is when I'm going to get back in touch with my provider to make sure that everything's okay for me. Um, you don't want to be sick either. And same thing with women, they have to, they're should are it's recommended they stop hydroxyurea during pregnancy. And many women will start blood transfusions. Some people say really early, even before you're pregnant, anticipating that you're going to be pregnant in women and starting blood transfusions, chronic blood transfusions to keep their hemoglobin high, dilute out their percent hemoglobin S, and so they themselves don't get sick and the baby um, seems to do better. To my knowledge, there's not a huge amount of literature on that, but the literature does show that that's very beneficial, and a lot of people will start transfusions early. It is controversial, but personally, I did take care of some young adults and even a couple older adults, and if they got pregnant. And if they got pregnant, then we would talk about it and start transfusions to make sure they didn't get sick and the baby, you know, did well. So,
yeah, I had to transition out of Dr. Q's care when I got pregnant.
yeah,
Yeah, that was
painful.
um yeah. To say the least. Um These are really great questions. We'll continue to talk a little bit, and I'm gonna do some rapid fire questions here. So in women during pregnancy, do you have to stop taking hydroxyurea? Yes. It's recommended to stop taking hydroxyurea. I stopped taking hydroxyurea when I got pregnant, and all was well. My pregnancy was great, and there weren't any issues with that. Um, I have a couple questions about hydroxyurea, particularly around weight gain and weight loss. And so one of the questions, this is a very important question, so I'm really happy you asked it. If a patient is taking hydroxyurea, has lost weight, will the amount of the dose taken decrease. And so I just want to call out the importance of this question here because your dosage of hydroxyurea will change. I have been on hydroxyurea probably since 2017. My dose has changed. It's never, I'm taking 2 capsules every day for the rest of my life. Because I've gained weight, because I've lost weight, because my maximum tolerated dose has changed. So if you have to change doses for hydroxyurea, that's completely normal. And I want you all to know that. And actually, dosage is very, very important for efficacy of hydroxyurea. So they have to get the dosage right in order for it to work properly. So I'm so glad you asked that question because dosages should change based off of, the changes that happen within your health or within, just your body. So, Dr. Q, could you talk a little bit about that? And then also massive weight gain and hair loss. I have a friend who said they gained weight when they started taking hydroxyurea. I'm trying to think. I think I gained weight too when I started taking hydroxyurea. I think I did gain weight. I don't know if it's age or if it was hydroxyurea. Um, Massive hair loss. I haven't heard anybody have like massive hair loss. Personally, I did not have any hair loss when taking hydroxyurea, but it varies from person to person. And, one of the things I like to say is if I was losing my hair doesn't keep me alive, my organs keep me alive. And so that's kind of how I put that in my head, right? Like I need my organs more than I need my hair. So I was like, if I start losing hair, I'm gonna go ahead and take myself down to the wig shop, find a cute wig or, braid shop or whatever, and I'm gonna make it work. So sorry, that was a little ramble, but Dr. Q, can you talk about the importance of dosage and whether you see weight gain with hydroxyurea?
Well, you might see weight gain because you, for people who have sickle cell disease, your bone marrow is this is mostly in pediatrics. I am not an adult doctor, but I assume physiology is the same for everybody. So, um, your body, well, if you're not taking hydroxyurea and you just have sickle cell anemia, your body is really using up a lot of energy to make blood. And so, what a lot of kids with sickle cell disease are kind of on the thinnish side because they
That
are
was
kind of
me.
eating normally for a child, but not for um, not for a person with sickle cell because you need extra calories. So once you start taking hydroxyurea, if you're fortunate and your hemoglobin goes up, your fetal hemoglobin goes up, and your bone marrow kind of like gets in the hammock to take a rest because you don't have a lot of stress on your uh, bone marrow anymore, that might contribute to you gaining weight. The other thing is you might feel really a lot better. And so if you feel good, sometimes it's like, hey, I think I'll go out and go somewhere and have a couple of hamburgers or
Ah,
whatever you like to eat.
what's
I mean,
happening?
I mean,
Now that
you
you have
really,
energy, you go eat junk
yeah.
food.
I mean, if you feel crummy, I mean, I don't have sickle cell, I don't know. But if you feel crummy, you may not, you just don't have an appetite. And as you feel better, then you're gonna eat
Yeah.
more. And on top of that, your bone marrow doesn't need as much calories to keep your hemoglobin up. So over time, none of this stuff happens in a month, but over time, like a year or something like that, sure, you could gain weight. And the other thing is, you might be used to being skinny. So you may be used to having this thin body that you
Yes.
could just eat. And
Yeah.
it's like,
Yeah.
hey, I can eat like anything and I
The
don't gain
good
a
days.
pound. And then all of a sudden, your body image starts changing. You may not really be overweight, actually, but to you, you look different. and you look a little more substantial, I should say. And so
Yep.
you're worried that am I going to get fat? Am I fat? So uh, there's a lot of subjective stuff there. You're kind of like,
Yeah, a lot of people want to gain weight too.
yeah,
Like a lot of
yeah,
we get
yeah.
questions like, how can I gain weight because I'm so
Yeah.
skinny with sickle cell? That was me for like half of my life. And now I'm like, how can I lose it? But yeah, it's really subjective.
Yeah, it is. And depending, if you're a guy, you might want to gain weight. You might, I'm going to go start working out and I'm going to start gaining weight and whatever. And I can do that now that I'm on hydroxyurea. Because, but a woman might just go like, hey, I liked, you know, being a size 6 dress or whatever they, I don't know what sizes are, but being thin. Thin is, that's also a cultural thing. Like in this country, it's like you look at the models, women models, they're all really skinny. And I mean, they're almost too skinny to me. But that's kind of what the model for people to try to emulate. It doesn't mean it's healthy, that's for sure.
Well, I mean, there's also the Black community too.
Yeah.
That is not necessarily like, being Black, I don't want to be thin. I want to round out.
Right. I mean, really, I see some women and I'm like, girl, you are way too skinny. You got to put on some weight.
So yeah, there's cultural context, all of that. But how about dosing and, maybe losing weight? You found that you've lost weight. What could your dose change for hydroxyurea?
Could that change your dosing if you were
Could that
losing
change your
weight?
dosing
Oh
if
yeah,
you've
yeah,
lost
yeah.
weight?
So
Yeah.
so if you put on weight or you lose weight, depending on how much it is, it's going to change your dose because you have to think about it. The any drug you take, well, some drugs it doesn't matter so much, but it gets diluted out in your body. And as your body gets bigger or smaller, the concentration of that drug changes because you're taking the same dose and say you put on 60 pounds or something, whatever, that could definitely change your dose. In pediatrics, it's an assumption that over time kids are going to get bigger. When you're 5, you're when you're in kindergarten, you're a little teeny kid, but when you're in the 4th grade, you're pretty big. And so you're going to, during that time of really rapid growth, you're going to have to change the hydroxyurea dose, and you're going to have to do more testing to make sure you're not underdosing or overdosing. But more means, um, every couple of months, something like that. And you want to be sure that a lot of people kind of focus on the CBC, but you really need to have the complete blood count, but you really want to have a reticulocyte count, which is not generally part of a complete blood count. And you want to know what's going on with the white count as well.
I just want to there's a comment here and there was one some person said I don't sickle often anyways. So this was in regards to them taking hydroxyurea. They said that I don't sickle often anyways. I just want to speak to that particular part of the comment. They said I only deal with an episode maybe twice a year. Um, and I just want to share that sickle cell is constant. I'm sickling right now. I'm not in any pain. I'm not in a pain crisis, but I'm sickling right now. So a lot of people think that sickle cell is only a problem or there's only detriment to your body when you're having a crisis. There's detriment to my body right now while I'm not having a crisis. And so not a lot of people know that. And I'm really trying to get the word out about that because people think they're fine in between crisis, and you might feel fine, right? But sickle cell is still sickle celling, and the blood cells are still breaking down. Oxygen is still not getting delivered, whether you are in pain or not. And so that was another reason why I started taking hydroxyurea, because it's the hemolysis, or the hemolytic anemia. It's like the silent part of sickle cell. There's a silent part of sickle cell. There's a loud part, which are the pain crisis, but then there's a silent part where it's just like that background damage that's happening. And that's what really scared me. And it's that background damage that actually leads to organ failure or organ damage. And so that's what scared me the most about sickle cell. There's overt, I guess, overt damage, and then there's, the quiet damage. And so I just want you to know, or this person to know, that you're still sickling, even if you're not in a pain crisis, you're still sickling and that damage is still happening. So why I started taking hydroxyurea was to slow that damage down, so that, to preserve my organs essentially. So that's my little PSA surrounding that. That you all need to know that sickle cell is still being a hater, even when it's quiet. It's still being a hater.
I think that's a really good thing. There's the loud part and the quiet part. That's a very good analogy. So the loud part is when you have AVN, you have a pain episode, heaven forbid, you have like a stroke or something like that. That's the loud part, but the quiet part is going on all the time. You just don't, it just isn't obvious. Last summer, there was a paper that came out. It was sort of what they call a meta-analysis, where they take a lot of studies and they kind of try to make them all similar, the statistics behind them, to come up with a larger group of people that you can make better prediction for. And in this study was hydroxyurea that showed that children who take hydroxyurea, their incidence of stroke really goes down. And there's something called transcranial Doppler that predicts stroke. That um, study showed that their stroke risk went down when they were on hydroxyurea. So in children, you need to do the TCDs, the transcranial Dopplers, to predict stroke, but hydroxyurea seems to have some effect on that, especially in third world countries where getting a blood transfusion every month or something is just not practical. But it was kind of an eye opener for me because they did look at TCDs and stuff to show that how hydroxyurea decreased the risk of stroke in children. But you still need that TCD, even if you're on hydroxyurea. Strokes are forever. If you get a stroke and a child gets a stroke, their life is changed forever.
All right, you guys have some more hydroxyurea questions here. But first, before that, I wanted to call out this comment because I was like, yes, 100%. This this comment says, I think that the hardest part about having sickle cell is that I still have to be a participant in society and work and etc. But my energy is so different from everyone else. And that is real right there. It's like this invisible thing that you're walking around with. You look fine. Um, and you're expected to be a member of society and contribute when you are at deficit. So, my I'm married. I've been married for 13, I think. And my husband, he admits, like, you make it look so good. Like, I can't, he says, sometimes I forget I have sickle cell. And it's cool, but then it's not cool, right? At the same time. And you have to remind him. And I'll say, hey, I'm working with half the amount of blood that you have right now. Like, this is your hemoglobin, this is mine, this is how much blood you have, this is how much blood I have. Plus, my blood doesn't carry oxygen as well as yours. So that's like two dings right there. So yes, I may make it look easy, But there is sickle cell is very real. You can feel it all the time. You can feel the deficit. I always feel the deficit. I'll get a blood transfusion and I can feel my energy like it almost feels like life is being drained from your body. Like, when my hemoglobin is going down because that blood is no longer within my body. Um, so yeah, just don't be afraid to remind people. I'm working with half the blood you have, and my blood doesn't carry oxygen or do what it's supposed to do as well. So don't be scared to tell people that because they'll forget because we're working miracles here and walking around walking miracles. How about that? We're walking miracles and we make it look easy.
And people with sickle cell disease do make it look easy. I mean, when you walk into an emergency room and you have pain, the first thing the doctor might say is, well, you don't look like you're in pain. Well, that's because I've been doing this since I was a baby. Um, so yeah, people with sickle
I look
cell.
like I have pain when I roll up in the ER. I do. I
Yeah.
am like I'm rolling around on the floor like a 3-year-old. Anyway, um somebody asked, and there's a couple questions. What is the alternative if you want to have kids? What is alternative to hydroxyurea? And you spoke a little bit to this, although
Mhm.
controversial, right? You
Yeah.
you might start getting transfused um to make sure that you're ready, right? To be able to um have a child. This person says, I've been on apheresis treatment for years, since I was a kid. I'm now 26. They want to put me on hydroxyurea. Is that better?
That's a mean question because I'm going to say no.
Really?
I'm going to say no.
So that okay, so that question you could get different answers from different people,
Right. I mean, the
from
thing
different
is,
experts.
yeah, well, you're on high if you're getting exchange transfusions, at least the way I did transfusions. An exchange transfusion is like a simple transfusion. The doctor with a simple transfusion, meaning they just start an IV, they hang a bag of blood and they put it in, maybe get two, depending on what your hemoglobin is when you walk in. So it's kind of like it depends on what your hemoglobin is when you come into the day hospital or wherever you're going to get transfused. But with an apheresis, the doctor is in control of what your hemoglobin is going to be at the end of the treatment. So so I can look at what your hemoglobin is when you came in. I can look at what your percent S is when you came in, and I can kind of tailor to some degree, nothing's perfect in medicine, how much blood you should get in order to have a hemoglobin of 9 or 10, somewhere in that range, and a very low hemoglobin S. And the nice thing about apheresis is, you generally speaking, the difference between the blood that comes out and the blood that goes in is not a lot. So you don't become iron overloaded like you might if you were just getting simple transfusions. So apheresis compared to hydroxyurea, like Cassandra's saying, if your hemoglobin is 9, you're going to feel a lot better than being on hydroxyurea with a hemoglobin of, say, whatever, 7 or 8 or something like that. And the other thing with apheresis, some people, I didn't always do this depending on the person, but some people will leave their exchange with a hemoglobin of maybe 10 or something like that. So you're going to feel better. The other thing is you don't have to take medication and you don't have to be what we've been talking about monitored so closely because as your weight changes, you get sick, you have to fiddle around with the hydroxyurea. Um, but in terms of like the long haul, maybe being on hydroxyurea, wouldn't be a bad thing. You could, you can't just stop the transfusions and start hydroxyurea. You have to start hydroxyurea and then slowly change your apheresis protocol until your hydroxyurea kicks in. And it doesn't seem to work that great if you have a really high hemoglobin. So as they're weaning you off the transfusions of whatever kind, then you have to be sure that the hemoglobin or that the hydroxyurea is starting to work. You can't just say, okay, this is my last transfusion, I'm going to start hydroxyurea, because it takes about 6 months for hydroxyurea to really start making a big effect.
That's another thing people need to understand. It's not
Yeah,
like a light
yeah,
switch. You have to dedicate
yeah.
6 months to
It's not
see
like
if hydroxyurea is really
yeah.
working for you.
It's not like insulin where you have to take some insulin every day to metabolize to metabolize your blood or your food normally, etc. Insulin happens really fast, works immediately, but hydroxyurea doesn't. So that's a big difference. But you have to, it's something you need to talk to your doctor about, and your make some figure out what is best for you. It's a lot on another thing, it's a lot cheaper to take hydroxyurea than to be on exchange. That's, very
Yeah.
tech,
Yeah.
there's a lot of technology, expertise, and stuff that goes into that. On my Instagram, it says the live video ended.
It does.
That's what it says on mine. I mean, I have an old iPad. Maybe it's just me. I
Am
don't
I
know.
still there? I think am I still here, guys? Did Dr.
Uh,
Q?
I lost the Instagram.
Uh-oh. Is Dr. Q still there for you guys?
See, I can't tell. I'm just looking at somebody who has a bunch of really cute dogs.
Is there let's see.
Try to
I'm not s-
see. Let me do my re
Am I still here, guys? Can somebody comment and let me know if I'm still here?
yeah, I redid it, and
I don't see anybody.
yeah.
Oh,
I think uh people outside of Instagram should probably be not having a problem, but I don't see us on Instagram.
sheesh. There's a lot of questions that I'm trying to capture here. That wow. Okay. Before I go back live. Okay. Hmm. Yeah, it says I'm still live. I don't
Hmm?
know. But nobody has commented, so
No, it
maybe
is.
it's on my end. Let me end this.
No. Well, on my Instagram, I don't uh have us, so
Okay. Let's
and I
see.
tried to uh, I've kind of like totally lost it. But anyway,
Okay. I'm going back live again. Hopefully that you are now live. Hmm. I wonder if this works. Does it show that I'm live?
I don't see you up here on my Instagram.
Do you mind refreshing? Oh, it
Okay,
looks
there
like
we
I'm
go.
live
Now it's
again.
live. Okay, now it came back.
Sorry, guys. don't know what happened. We were just talking, talking, talking. Didn't realize you guys weren't there.
I sent you a request too.
Okay, get Dr. Q back here. You guys had questions. Great questions. Um, and we were talking all about hydroxyurea. I don't know if this person is still online. Um, But there's a couple more hydroxyurea, and then I'm gonna rapid fire this one. I have sickle cell trait, and my symptoms are of someone who has sickle cell. Is that normal? What I would say to you is go see a hematologist and verify that you have sickle cell trait. If you have
Yeah.
symptoms that are like somebody with sickle cell, you might have gotten misdiagnosed. There are symptoms and complications that are associated specifically with trait, but they are more rare. So I would just double check to make sure that you don't actually have sickle cell disease. That's a lot of people have gotten misdiagnosed for that. Um, this person said, my son has sickle cell. He's on hydroxyurea and it's working. He's 8 years old. Any supplements you would recommend? Thank you. So I don't think supplements and hydroxyurea really go hand in hand. It's just there are nutrients that many people with sickle cell are deficient in that you should always kind of just track. So Dr. Q, could you share what some of those nutrients are that most a lot of sickle cell patients are deficient in?
Well, the two that are probably most common would be folate and B12. But if you have a normal diet, like folic acid is in everything, your cereal, bread. If you're in the United States, outside of the United States, it's a different thing. But in the United States, it would be really unusual for somebody who had a normal kind of regular diet to be have a problem with folate. Vitamin B12, there can be absorption issues with vitamin B12. You can't absorb it. Um, that, or you don't eat a lot of uh, vegetable. If you're a vegetarian and you don't really have a varied diet, you might get vitamin B12 deficient. But those are the two common ones. Other things that you might be deficient in that would affect your sickle cell disease would be exceedingly rare. And I can't really think of any other tests that you'd look for some kind of deficiency.
So vitamin D,
Vitamin D is good for everybody, especially if you have dark skin because you're not going to absorb vitamin D. And vitamin D is associated with your bone development and all that. But it also has some other effects that are beneficial. So the other thing is you have to talk up with your doctor about how much you should be taking. Because again, like everything else, it's kind of weight related. And for instance, vitamin A, which is in carrots, uh, you can overdose on vitamin A and that can have detrimental effects. So you vitamins, if it's a water soluble vitamin like
vitamin
folic
C.
acid, vitamin B12, like you'll notice if you take a multi B vitamin, your urine all of a sudden turns really yellow. Well, that's because you just spent a whole bunch of money and now you see where it went because it's goes right through your kidneys and right out again. Um, so it depends on the metabolism, but if it's not water soluble, then it gets concentrated in your body, and that can be a problem, depending on what it is you're taking.
There's somebody named Nikisha Collins there
Yeah,
that is saying
yeah.
hi
I
to
know
you.
Nikisha. Hi, Nikisha.
Hi, Nikisha.
You
All
would
right.
recognize her if you saw her.
I'm sure I would. I'm really bad with names.
Yeah, so am I.
Um, where can we watch the full live stream later? The lives are always pinned to or they're always on our Instagram account. So you can always go back and watch lives on our Instagram account. And then also they're on YouTube. So I know a lot of times you want to multitask and um if you start watching something, then you have to kind of commit to keeping Instagram open on your phone, whereas YouTube you can kind of just listen or watch in the background. Um, Vitamin D helps immune system as well, and B12, folate, and this is Doc Diva Invest. Thank you, Doc Diva Invest. Um, are there any more? Oh, okay. Thank you for re-asking this. Oh gosh, another good question. All right. So what are your thoughts about the use of crizolizumab for refractory VOCs? Do you have an opinion on that, Dr. Q?
Well,
You have any thoughts?
I think it's a p-selectin inhibitor. It's an antibody, and it could have it did in the studies in the United States that got it approved by the FDA. It did decrease pain. But again, like we were saying at the beginning here, these people were also taking or could be taking hydroxyurea. And there may be a study out there where they parsed out the people who didn't take hydroxyurea and the people who did to compare those two groups. But there didn't appear to be enough people or any people who had acute chest syndrome in the crizolizumab study. Um, so they couldn't really say anything about that. There was a recent study where it was a very, very large study, but it was multinational and and it was during the pandemic, but a lot of the people were in countries that weren't developed. And remember, you got to get an IV infusion with crizolizumab. And if you're living somewhere where you can't always get that, then you're not going to you're not going to see an effect, right? So that particular study failed to reach its primary
Endpoint.
endpoints. So I personally feel like they kind of overextended themselves and were trying to use the drug like with hydroxyurea, it's a pill. So, people aren't totally 100% taking it every day, but they can take it, it's not a big deal. But with crizolizumab, you got to go somewhere, get an IV, get an infusion, even if it's only once a month or whatever. And so that failed, that study did not reach its endpoint. In the EU, crizolizumab is not approved for sickle cell
Right.
disease because they did not think it made that big a difference. There have been some other studies, but these are just single independent studies that need to be repeated and proved that crizolizumab may be beneficial for people who have priapism and one other thing that I can't remember. But these are single paper studies that need to be shown that, reproducible, that yeah, this is what happens. So crizolizumab, I think, is something you need to try to make to not don't just rule it out because of what I'm saying, but try it, see if it works for you. It might not work for everybody, and if you're not taking hydroxyurea, then you I would if I had sickle cell and I was thinking about crizolizumab, I would take hydroxyurea and crizolizumab. They work differently and they might be synergistic where they kind of help each other make you feel better.
Yeah, there's a Dr. Patrick Hines is doing research on responders versus non-responders to a lot of these therapies. And I'm not sure if he has any work within crizolizumab specifically, but definitely should check him out and check out his work surrounding that. Um, what is a VOC? VOC stands for vaso-occlusive crisis. It can also be VOE, vaso-occlusive episode, and that's just a fancy word for pain crisis. You
Hmm.
agree with me? It's a fancy word for pain crisis, a
Yeah, yeah.
VOC. Vaso means like vein, if you like want to get into Latin. Vaso means is it Latin? Don't quote me. Don't quote me. But vaso means vein. Occlusive means like obstruction or blockage, and then crisis. So that's what VOC means. It's a pain crisis, the medical term for that. Somebody asked a follow-up question around iron in supplements. I'm glad you asked that because a lot of people with sickle cell take iron thinking it's going to help their anemia. But what I think people may not understand is the anemia is not caused by iron deficiency. It's caused by actually having sickle cell. You have a actual genetic mutation that causes you to not make it causes your blood to break down at a faster rate. Sickle cells only live 10 to 20 days, where typically a red blood cell is supposed to live 120 days. So that's a huge deficit which causes anemia. But people think, "Oh, iron helps with anemia," but iron only helps if you're iron deficient. If you're not iron deficient, then it doesn't help with your anemia. So for me personally, and I'm glad you brought this up also because there are a lot of people who get transfusion and they have high iron levels, which can be dangerous and can lead to iron overload, which can shut down your organs. So I've lost a few friends to this. So it's very important to track your iron levels. But imagine you're getting transfused, you have high iron levels, and you're taking iron supplements. That can be very, very dangerous. So I like to caution people iron does not fix the anemia that is caused by sickle cell. It only fixes if you're iron deficient. And so some of us with sickle cell can be iron deficient and taking iron would be appropriate, but if you're getting transfused often, you more than likely do not need that additional iron and it's important to make sure that you stay on top of that and track that because it can have life-threatening um, effects if you have too much iron. Dr. Q always says the body cannot get rid of iron naturally, so there are medications where you can take to get rid of that iron, but your body holds on to that iron. It can't get rid of it. And so that's why iron overload is such an issue within sickle cell. A lot of people aren't tracking how many transfusions they had and taking in that extra iron. And then, maybe they have a supplement that has iron in it too. That's just not great. So thank you for asking that. It really is dependent upon whether you're iron deficient or not. And that's how you determine whether to take iron or not.
Right. So you should just, the doctors can do some blood tests to see if you're iron deficient. But if you've had transfusions, if you get say two transfusions a year or two, then the chances of you being iron deficient are less than someone who's never been transfused. We can only
There's a
do,
really very, very interesting question here. I'm so
yeah,
intrigued.
yeah.
I didn't read the whole question, but it had Japan in it, so I'm gonna. I had a crisis that didn't get attention in Japan. 3 days lag. Consequentially, I got a neuropathy damage in my lower lip with numbness and tingling pain that wouldn't go away. I'm consulting. So it looks like this person got numb lower lip, which is common within sickle cell. So don't fret. Oh gosh, this question is really long. Uh-oh. Okay, sorry. I consulting with the neurologist and taking an MRI test. But my question is, do you know what caused this and what would be the best path forward if there are treatments in hopes as my neurologist? So if you're talking about the numb lip, the numb lower lip, that happens in sickle cell. That's I don't know if it's common, but it happens. A lot of people have talked about it. I've gotten it myself. Usually I get it when I'm hospitalized. I'm not sure that people know what it is exactly, but it's a thing for sure. Dr. Q, any comments on that?
Yeah, well, you know, you can have sickling everywhere, and if it's a neuropathy in your face, it could be that you're having some inflammation around where the because all the nerves that innervate your face, or a lot of them, have to come through your skull, through your max. You know, they don't come from down, you know, from somewhere else up to here. And so where they leave the skull, if there's inflammation around there, they can get pinched, and that is going to cause like numbness, tingling, that sort of thing. Um, I would say that it's due to inflammation. So anything, you'd have to talk to your neurologist, but anything that would decrease inflammation, I would at least try that just to see if it made a difference. It's not a bad idea to do MRIs in people who have sort of um, symptoms that you can't really explain very well because uh, there are issues, you know, but yeah. So I think that's okay, and but you might think about using a non-steroidal anti-inflammatory just to see if it makes a difference. You'd have to do it for a couple days, though, a few days.
And last time I got numb lip, it was there for a couple weeks,
Yeah.
I want to say. So if
Did
it
you
doesn't disappear right away, uh-huh.
did you notice if you took it like if you were taking medicine like an anti-inflammatory, it made any difference?
I didn't notice, but you know what? I always thought it was from getting opioids in the hospital. That
Hmm.
was just my hypothesis. And I thought it was a weird thing that happened to me and then said it one time online and everyone's like, "Oh, yeah, the same thing's happened to me and happened to me." And Dr. Julie Cantor, I don't remember what her response was, but she did have a response particularly to the numb lip and why it happens, but I don't remember what it is. So if you want to look up Julie Cantor, she's out of UAB, and maybe try and send her an email and ask her what's up with the numb lip or what do you know about it. But I feel like not a we don't know like a lot about it. So I saw a blurb that was that, and sorry, we have to wrap up soon, but I just
Yeah,
want to
I have
keep
to go get my
answering
little
questions.
baby.
Oh my gosh, oh my gosh. Okay. Do you have time for one more or should we
Yeah,
cut
yeah,
off?
yeah. Yeah, yeah.
Okay.
She's not far away.
Sorry guys, I usually give warning. Um, I saw a blurb that the first person cured of sickle cell was done recently in New York. Is this true? How was it achieved and what is the cost? Any info would be appreciated.
The first
I
cure
don't
of
know if they're yeah, I don't think they're the first. People have been getting cured of sickle cell since the 80s.
yeah,
But if you're talking about particularly this thing, I think I saw it was through gene therapy, which I don't think they're the first. Maybe they're the first in New York. I don't know.
yeah. Yeah, it sounds like gene therapy. And then again, there's two different types. They're both FDA approved. So yes, there you can be, you know, yeah, it's a cure. And a sort of a lot of people call it transformational because you still have sickle cell disease. So yeah, I know. So you still have
Okay.
I just
Are
got
you
reminded that it's time to
Yeah,
pick
you
up
gotta go,
my
right?
baby.
Okay. All right. We don't want to leave his grandbabies waiting. So we will be back in 2 weeks. Thank you all so much for joining us on the live today. If you didn't get one of your questions answered, please feel free to send it to ask at sc101.org and we When I say we, Dr. Q does such an amazing job of answering them and provides all the references and sources that you, if you're a nerd, that you could ever want. So please feel free to shoot us an email at ask@sc101.org.
And
Anything parting?
so this is my little blurb after this. So we're not Sickle Cell 101 is for education only. So we're providing information and we're not fact checking everything every minute. So you have to take some of what I say with a grain of salt, but you could, if you hear something from me that you are questioning, ask your primary care physician. Those or your caretaker or whatever. Those people are the people who know about your medical history. They know what your current problems are, what your medications are, and they're the people who you should be asking about questions about your specific your path through sickle cell disease. This is just for information, and I'm just doing this off the top of my head, so I could definitely make some wrong and give somebody the wrong impression or the wrong information. So if you hear something from me, make sure you check it out. If you do send a question to Ask Dr. Q, I take a lot of time to make sure that what I'm writing is true. And I will, like Cassandra says, I would give you the references that show that, at least in the literature, this is what people think. So thank you so much for tuning in today. We'll be back in 2 weeks, right? Barring any other thing.
Yes, we'll be back in 2 weeks. We will be back in 2 weeks,
Yeah.
and I
And
can't wait
then
to talk to you all then.
yeah. And then I'm gonna have to go get my little 3-year-old from not mine, my daughter's 3-year-old.
Thank you guys so
From
much. Have a wonderful weekend ahead. Take care,
bye-bye,
drink your water, get
everybody.
rest. Bye.
Yeah, it only takes about 5 minutes.